So I'm going to be doing a physical assessment of a newborn male. So to begin, I would introduce myself. Hi, my name is Michelle, and I'll be your student nurse today. Perform hand hygiene, and I'll just let the family know that I will be performing a physical assessment of the newborn. So to begin, I would check its posture. So before doing any disturbing for assessment, I would refer to the maternal chart for fetal presentation, position, and type of birth, and also just inspect the extremities for flexion, normal, spontaneous movement, bilaterally asynchronous, which is also known as a bicycle movement, and just check for equal extension in all extremities. So then I would check vital signs, so check heart sounds and pulses. I would auscultate the mitral, pulmonic, aortic valves, so I would just check all the different heart sounds. And then I would listen for murmurs, check for the peripheral pulses, and then I would assess a temperature. So the auxiliary method would be the method of choice, and it should be between 36.5 to about 37.5 degrees Celsius. I would observe and monitor a respiratory rate and effort, so I would count the respirations for 1 full minute, and that should be around 30 to 60 breaths per minute on average. And then I would auscultate the breath sounds, and crackles may be heard after birth. Then I would obtain blood pressure by using the appropriate size cuff. So normal readings would be between 60 to 80 systolic and 40 to 50 diastolic. It may change depending on the activity level, so if the baby is like sleeping, crying, or awake. And then I would check the baby's weight. So I would put a protective sheet on the scale. And for a male, it should be around 3,500 grams. And the baby should regain its birth weight within the first 2 weeks. And then also I would check the length. So from the top of the head to the heel. And the average findings are around 50 centimeters. Then I would check the head circumference. So measure at the greatest diameter. So average findings are around 33 to 35 centimeters. And then I would inspect the skin. So check just the general color. It should be pink, but it may vary depending on ethnic origin. You also want to observe for birthmarks or bruises, and just check the skin condition. And then also check for jaundice. And then I would inspect the head. So you want to palpate the skin and just inspect the size and shape, and just the molding. You want to palpate, inspect, and note the size and status of the fontanelles. Palpate the sutures, and then inspect pattern, distribution, amount of hair, and also the texture of the hair. And then you want to check the eyes. So just check the placement on the eyes, the symmetry and size and shape. Check the eyelids for movement, blinking. And then you want to assess for any discharge, and then evaluate the eyeballs for presence, size, and shape. You want to check the pupils, just evaluate the eyeball movement, and then just assess the eyebrows, the amount of hair and the pattern. And then you want to check the nose. So observe the shape and placement, patency. The nose should be midline. And there might be some mucus, but there should be no drainage. And then you want to check the ears and observe the size, the placement on the head, the amount of cartilage, and just make sure that the auditory canal is open. And then you want to check inside the mouth. So just inspect the mouth, and then assess the buccal mucosa, so it should be dry or moist and pink. Assess the lip for color, configuration, and movement. You want to check inside the gums, and they should be pink. Assess the tongue, make sure it's not protruding and it's able to move around freely. Assess the soft and hard palates, make sure they are intact. And then assess the chin, evaluate saliva for amount and character, and just check reflexes, so rooting, sucking, extrusion. And then check the neck, just inspect the movement, flexibility, masses, bruising, check movement and position of the head. And then you want to check the chest, so inspect the shape. It should be almost circular, barrel-shaped. Observe respiratory movements, evaluate the clavicles, assess the ribs, and then the nipples for size and placement. And then also the abdomen. So inspect the umbilical cord. It should be dry around the base, odorless. Inspect the size of the abdomen and palpate the contour. It should be round, prominent, and dome-shaped. There should be no distension and no palpable masses. Also, auscultate the bowel sounds, and the sounds should be present within minutes after birth. And then you just want to do the 4 quadrants, and then note the number, amount, and color of stools. So meconium should usually be passed within 24 to 48 hours after birth. And then the genitalia. So for the male, you just want to inspect the general appearance. Foreskin should be covered. Glands. The foreskin should cover the glands if it's uncircumcised. Do not forcibly retract the foreskin, and then the testes should be palpable on each side, and check urination. The infant should void within 24 hours. And then you just want to flip it over and then check the back. Spine should be straight. Shoulders, scapula, and iliac crest should be lining up in the same plane. And then the anus, just check for a good sphincter tone, and passage of meconium should be within 48 hours. Thank you.